Hi everyone, welcome back. I'm Jin Su. In the previous session, we briefly discussed the historical development of modern nursing in Western countries and the definition of nursing. In this session, I will further talk about the historical and current development of nursing in China. By the end of this session, you will be able to describe the historical events influencing nursing development in China and verbalize understanding of the contemporary nursing development in China. In the long history of China, traditional Chinese medicine, in the abbreviation of TCM, influenced people's health deeply. TCM has been practiced for over 2,500 years in various forms, including herbal remedies, acupuncture, massage, exercise, and diet. It takes a holistic approach to view and treat the mind, body, spirit from a wellness perspective. The focus is on cultivating the healthy internal harmony. Although medical treatment, environment, patient spirits, and care are equally important for recovery in TCM, there was no professional nursing in ancient China. Modern nursing started in China due to the influence of Western missionaries arriving after Opium War in 1842. But before 1835, the first Western-influenced hospital was established in Guangzhou. The first American nurse, Elizabeth McNee, came to China in 1884 and began to introduce the Florence Nightingale nursing system in China. In 1888, the first school for Chinese nurses was opened in Fuzhou by another American, Ella Johnson. She was later joined by Nina Gage, who arrived in 1908 and then established a nurse training program in 1910 as part of the Yale mission. Nina Gage later served as president of the Chinese Nursing Association between 1912 and 1914. In 1920, Asia's first 5-year bachelor nursing degree was established at Beijing Union Medical College. Between 1924 and 1952, about 300 nurses with bachelor degree graduated from PUMC. Among them, many became prominent nursing leaders and talents. Wang Xiuying, who graduated in 1931, is known as the first recipient of Florence Nightingale Medal from China. She was a nurse, educator, and a pioneer in nursing education and public health in China, and contributed to the nursing and public health development after the establishment of People's Republic of China. She described nursing as the patient will be hopeless without medicine. The patient will be helpless without nursing. During 1952 to 1979, the only nursing education programs were diploma programs, which was also called certification programs. Most of the programs were 3-year training curriculum and recreated junior high school or high school graduates. Until 2000, diploma program trained nurses made up the majority of workforce at different levels of hospitals in the country. One of the hallmarks for current nursing development in China is that after 1979, post-secondary nursing programs were re-established gradually in China. In 1983, Tianjin Medical College, now Tianjin Medical University, launched the first 5-year baccalaureate nursing program. After that, baccalaureate nursing programs have sprung up across the country. The first master's nursing program was set up in 1992 at Beijing Medical University. A bachelor's degree was a requirement for admission to the master's program in China. The first doctoral nursing program was created in 2004 by Central South University and the Second Military Medical University. A master's degree was required for a student to enter the doctoral nursing programs. The objectives of doctoral nursing education focused on three main areas: professional values, professional development abilities, and professional culture of the human spirit. The international perspectives and international activities, and nursing research abilities. Currently, in China, the number of nurses has been increasing fast. From the table, we can see there were only 405,200 nurses in 1980, but by 2018, there were 4.3 million nurses in the whole country. In 2006, WHO estimated that at least 2.5 medical staffs, physicians, nurses, and midwives per 1,000 people would be needed to provide adequate coverage with primary care interventions. But in 2012 in China, there were only 1.6 nurses per 1,000 people. This number increased to be 3.1 in 2020. The increased number of nurses reflected a big demand for nursing services in China, and it also brings great chances of development of Chinese nurses. On the other hand, the educational structure of Chinese nurses has been changing dramatically. In 2018, there were 25.5% nurses of certification program, 50.4% who were graduates of associate degree, 23.5% of baccalaureate graduates, and 0.2% of master's graduates. Compared with 51.3% in 2010, in 2020 there are 70% nurses with associate degree and above. From the data, we can see that nowadays, most of registered nurses working in the hospitals and other clinical settings have college-level education or above in China. Started from the 1990s, specialist nursing has developed very fast in China. Every year, the Chinese Nursing Association holds specialist training programs in different nursing fields, such as complex intravenous therapy, wound care, diabetes care, and so on. These nursing specialists have played an effective role in hospitals, communities, and patients' families by facilitating the standard of specialty nursing, dealing with complex problems, teaching students in the academia and patients in the hospital, as well as conducting research activities. Currently, in China, the nursing role has become more and more important in health promotion, disease prevention, health restoration, and the care for the aging population. The scope of nursing is expanding. Nursing in China needs to develop rapidly and scientifically. The key points of development are: first, educational reform should be conducted based on national health priorities and people's health needs. Nursing education should prepare nurses to work effectively in multidisciplinary teams with maximized graduate competencies in health technology. Second, the role of nurses in both primary care and specialty care should be enhanced and standardized with national and local health policy. Third, nursing theories grounded in Chinese society should be studied and developed to guide clinical practice. Evidence-based clinical practice and management need to be improved nationally. In this unit, we briefly introduced the history of the modern nursing development in Western country and China. Nursing as a profession has its own theoretical foundation. We should use practice models and the nursing process to identify health problems and implement care delivery to patients. In the next unit, I will further explain what nursing process is and how it can be applied to patient care. Thank you for your attention. See you next time.